Hello guys, this is Dr. Kwedhi back again with another video, and today we are going to look at EVALI. I'm sure you may have seen quite a lot of people on the street or somewhere in the mall vaping, and you may have wondered what's up with all these vaping, and is it all that cool? Is it all that cool to be vaping as so many people are vaping these days? Is it a viable option to cigarette smoking? Is it healthy for you? All right, so let's delve right into it. Right, it was the year 2003 when a pharmacist in China developed the first vaping device, the first e-cigarette. And then the following year, the vapes, the e-cigarettes became very popular, very mainstream, and spread throughout the world like wildfire, such that by the year 2020, it was reported at least that in at least 49 countries, people were vaping. People were using e-cigarettes from Asia to North America, South America, Africa, Australia, New Zealand, and everywhere. Russia, of course. And it was estimated that by the year 2021, which is last year, about 68 million people would be vaping. Just think about that. That's quite a huge number. 68 million. All right. And because, as you can imagine, because of that, such a huge number, such a, yes, огромное количество, a big number of people vaping, they are raking in, this industry is raking in billions of dollars. So they make at least $2.5 billion in 1 year. And there has been a lot of changes, a lot of development in this industry, such that to date, there are at least 4 generations from the first generation e-cigarettes that were developed to look more like combustible tobacco cigarettes, to now the 4th generation e-cigarettes that are also referred to as MODs, the modules. They are also designed to look like USBs so that they're easy to conceal. So as you can imagine, this industry is pretty much employing the tactics that were used by the tobacco industry, and they're very sneaky. They're very sneaky guys. They have a lot of flavors and all such things that we'll look at. So, is vaping a viable alternative to cigarette smoking? Well, that is how it has been touted at first. You know, when these big pharma came up with, when the pharmaceutical industry in China came up with the vaping devices, it was being touted, it was being promoted as a safer alternative to smoking. You know, it was being promoted as an alternative to cigarette smoking, as a way to help people quit smoking. However, we now know that e-cigarettes are unsafe. Lots of studies have been done. And literature is now clear. I know that there are a lot of scientists who are divided over this issue. There are literally 2 camps in the scientific world that are at hostility against one another. One camp that staunchly supports cigarette smoking, and another camp that staunchly opposes cigarette smoking. And it's like the battle lines have been drawn. And nobody's willing to back down. But nevertheless, studies have been done to show that e-cigarettes are unsafe, they are harmful for your body, and they increase your tobacco smoking. They increase your chances of smoking tobacco. Yes, people that vape, many of them ended up smoking tobacco. And you know, and so not only do people who vape smoke tobacco, but it encourages people to vape. Obviously, it is designed not only for, it has been designed, and and most of the people that vape are not those that have used tobacco cigarettes before. So most of the users of e-cigarettes are new users, new vapors, if you'd like to say. And as a result, these new users, having vaped for some time, they're eventually pushed to the other spectrum where they end up smoking tobacco cigarettes. So what is in these devices? What's the issue about e-cigarettes? Why are they so dangerous? Well, studies have been done by the Food and Drug Administration in the USA, as well as by the Center for Disease and Control, and many other governmental agencies in the US. And it has been proven that there are so many different toxins within the e-liquids, that are used in e-cigarettes, e-liquids. Hundreds, a lot of hundreds of toxins, substances. We know that the cigarettes, the combustible cigarettes, we know that combustible cigarettes, of course, they are full of toxic stuff, yeah? Thousands. We know that there are thousands. Of course, the same way, even in the e-cigarettes, there are even up to thousands of different toxins within e-liquids. And every day there are new types of liquids being developed. And there's virtually no control over the number and quality of e-liquids. So not only are there many different types of toxins, but they are of high concentration. Case in point, case in point is that the nicotine that is found in e-cigarettes is of a higher concentration compared to the nicotine that is in tobacco cigarettes. The nicotine concentration is far much higher, and that's the whole point, right? To give people a high dose of nicotine and hook them so that they don't stop. Yeah, that's the whole idea. Just like the tobacco cigarettes when they first came out. And as you can imagine, these toxins, these substances are highly addictive, and they're also highly hazardous for your body. Of course, we know nicotine is one of those substances that are so full within the e-liquid. Caffeine is another substance that you can find. They also have menthol. They have vitamin E acetate, which is used as a diluent for tetrahydrocannabinol especially. You can also find alcohols there, ethanol, olivetol, and then delta 9 tetrahydrocannabinol, which is the cannabis, etc. So there are virtually hundreds of flavors, so many that are, of course, designed to mimic fruit flavors. Yeah, that most of them have names that sound like foods. Whether it's cinnamon or strawberry flavors or what else? So many different types of flavors, virtually hundreds. It's almost like every vaping shop has its own flavors. Even if you may find certain flavors in different vaping shops, you likewise find flavors that are varying between the different vaping shops. Now, I want us to look at the next. I want us to look at the next thing. The next thing I want us to look at is how vaping works. How does vaping work? Of course, we know that when we talk about e-cigarettes, when we are talking about e-cigarettes, we have a module. You have the module device. You have the module there. You have the module, and then this module has a battery, and then it has the e-liquid, and then it has the coil that heats up the e-liquid, and then you have the mouthpiece. So when the switch is switched on, and then the vapor inhales. Once he inhales, the battery begins to heat up the coil. And once it heats up the coil, very high temperatures, by the way, very high temperature, thermal break, and then the coil, via thermal breakdown, it breaks down the e-liquid. Once it breaks down the e-liquid, once it hits the e-liquid then vaporizes. And as it vaporizes into fine particles, fine oily particles, these oily particles are then inhaled by the vapor through the mouth. You see that? And so the heating of either e-liquids produces an aerosol, and this aerosol is inhaled into the lungs. Now, this aerosol is usually, as we said before, having a very high concentration of the toxic substances, of the psychostimulants, such as nicotine, tetrahydrocannabinol, and many other things that are found within the e-liquids. Now, what's the problem? Once this breakdown of the e-liquid happens, then you have the formation of hazardous, very dangerous, low molecular weight daughter compounds. These hazardous, low molecular weight daughter compounds, in turn, they are the ones that end up harming the body. They're the ones that end up harming the lungs. Some of those daughter compounds are such as the carbonyl compounds, and these carbonyl compounds are such as acetone, right? The likes of acetone. What else? The likes of formaldehyde, as well as acetaldehyde. These are all toxic stuff. Formaldehyde is used in preserving of cadaveric products within the anatomical pathology labs and pathological labs, and then you have acetaldehyde, which is the byproduct of alcohol, when it's broken down. And it is when people drink alcohol, for example, this alcohol is converted to acetaldehyde, and it is the acetaldehyde that ends up damaging the eyes, as well as the kidneys, as well as the blood, damaging the blood, causing rural formation and all those things. Low molecular weight daughter compounds are also such as the nitrosamines, and nitrosamines are some of the byproducts of tobacco smoking as well. Right. What about the side effects of e-cigarettes? Well, certain study has been done to find out how are they affected by tobacco, not tobacco, but by vaping. And we found out that patients who have e-cigarettes, they develop respiratory injury. This is lung injuries. Moreover, they develop traumatic brain injury. Others have developed poisoning as well as allergies. Right, as well as allergies. Now, it was not until 2019 that that vaping really established itself as as an issue of great public health concern. In the United States of America, they began to identify, especially in the states of Illinois, Missouri, Illinois, they began to identify that certain patients were coming to the hospital with severe COVID-like symptoms. They would come with, we would look later at the symptoms of EVALI, but they came with all these very severe inflammatory condition of the lungs. And at least 2,807 people were hospitalized by the year 2020, and 68 people died. Unfortunately, 68 people died. And most of these patients are men. Of course, women were also affected. Women were also suffering from EVALI, but 68% of them were male, young and relatively healthy young males of the non-Hispanic white ethnicity. EVALI has also been reported in Australia, the UK, as well as Canada. Now, when we look further into EVALI, we find that EVALI has been established as a diagnosis of exclusion. Unfortunately, there are no specific markers, specific markers for laboratory exam, or specific radiologic patterns that can give you a straight up diagnosis of EVALI. Most of the laboratory, radiological, and histological exams are results, the presentation, laboratory presentation, clinical presentation, imaging, radiological presentation, histological presentation, as well as laboratory results are non-specific. They are non-specific, meaning these are presentations that are found in other conditions like autoimmune conditions, as well as infections, as well as COVID and such. So you have to rule out these other conditions in order for you, before you can establish the diagnosis of EVALI. So you have to rule out the pneumonias, you have to rule out asthma, you have to rule out infections, you have to rule out COPD, you have to rule out cardiovascular diseases, you have to rule out the autoimmune diseases like the granulomatous autoimmune diseases, even cancer, you have to rule it out. Many a host of other conditions. And the case definition is that the patient, when they present, they should have a history of vaping at least in the past 90 days. And they're appearing with acute lung injury. And of course, they present with constitutional, respiratory, as well as GI symptoms. And funny enough, certain patients don't even present with respiratory conditions. They present there was a young man that presented with constitutional symptoms alone, as well as GI symptoms. Especially the teenagers, some of them present only with GI symptoms. They just come with vomiting and diarrhea and nausea, and you're wondering what's up with this with the kid. And if you probe further, you find out that he's been vaping. Constitutional symptoms such as fever, malaise, general body weakness, as well as chills. Respiratory the respiratory symptoms are such as dyspnea, difficulty breathing, as well as tachypnea. You have hypoxia. You have also hypoxemia. Hypoxemia, of course, that is not a symptom. That is you determine that by pulse oximeter, and you do ABG. You find hypoxia there, but yes, it's a constellation of non-specific signs and symptoms. The studies that have been done to identify what is the main causative agent within within the e-liquids that is really the main culprit of EVALI. Was it really that causes EVALI? Most studies have identified vitamin E acetate as the main causative agent. That is because more than 85% of patients that developed EVALI, when they were interviewed, they reported that they have used tetrahydrocannabinol containing vaping devices. So they used cannabis containing devices. 85% of them. Of course, some of them use both. They use both nicotine containing as well as cannabis containing devices. They mix. The majority, at least 60%, mix, and at least 40 to 60% use nicotine alone. And for those that use the nicotine, at least 60% use nicotine, at least 85% have used cannabis. But it is interesting to note that even if vitamin E acetate, which is a diluent for tetrahydrocannabinol, has been identified in the bronchial alveolar lavage, BAL, bronchial alveolar lavage of patients that have developed EVALI. Another study was done to find out the content of nicotine in the nicotine containing vaping devices, as well as the concentration of nicotine in the non-nicotine vaping devices, non-nicotine containing vaping devices. So nicotine containing devices and non-nicotine containing devices. And the study found out that the nicotine containing devices had a very high concentration of nicotine, sometimes and most of the times far higher, much higher than what is reported on the labels, of what the manufacturers have labeled on the devices, on the e-liquid containers. But surprisingly, surprise, they found out also that the devices that were labeled to have zero nicotine, they also contained nicotine. That all the devices that were reported to not contain nicotine, they also contained nicotine. In fact, some of them have had higher concentration compared to those that reported to not have contained nicotine. Are you getting me? So certain devices that reported to only have tetrahydrocannabinol and not nicotine actually had a higher concentration of nicotine compared to the concentration of nicotine in nicotine-containing devices. What a surprise. What a surprise. Who would have thought, right? So even though the studies conclude that, have not really concluded, but they suggest that VEA is the major cause, but now it is now clear that even if 80% have report to have 80 more than 85% of EVALI patients self-reported to have used tetrahydrocannabinol compared to the 60% who have self-reported to have used nicotine-containing devices, we can actually safely say and hypothesize that 100% of vaping devices contain nicotine. Therefore, you cannot rule out nicotine because it is virtually in all the devices. And we know the side effects of nicotine on the brain and all the other organs of the body, especially in the young people. Now, so I've just explained that the vaping devices containing nicotine and those that say they do not contain nicotine, they all contain nicotine. Now, vaping causes harmful toxicities. These toxicities include an increased oxidative stress, especially on the lungs, of course, many other organs, the stomach and elsewhere. And vaping, these harmful toxicities, the acetaldehydes and formaldehydes and the acetones, they also trigger the pro-inflammatory cytokine release. They also trigger, apart from just increasing the oxidative stress, they also trigger pro-inflammatory cytokine release. As you know, that now complicates when a patient comes to the clinic or to the hospital and they are presenting with COVID-like symptoms. It's because they are both COVID and EVALI are both inflammatory conditions. Patients, when they present, what about clinical presentation? Patients present with mild to severe symptoms, anywhere along that spectrum of mild to severe. Some can only may present with mild nausea or fever or high temperature, that is, or chills, as we see here. Some may present only with respiratory conditions, respiratory symptoms, tachypnea, tachycardia, cardiopulmonary, that is, tachycardia, that is a cardiac symptom, dyspnea, both cardiorespiratory symptom, hypoxia, when you test with your pulse oximeter, and when you do your ABG. So they may present with one or more, any combination of these signs, of these symptoms. Yeah, some patients present with vomiting, diarrhea, stomach ache. Those are GI symptoms. Some present with constitutional symptoms like fever, chills, malaise, and with general weakness. And as I said before, surprise, some patients, they did not present with any respiratory conditions, with any respiratory symptoms. They only presented with GI as well as constitutional symptoms. So you need to have a high index of suspicion. You need to have a high index of suspicion so that you can start treatment early enough, because if you don't start treatment early or you end up sending the patient home, these patients, usually, because the studies have found that the presentation of patients to the hospital after they develop their first symptoms is generally the same, whether they are older or younger, whether they present with severe or mild conditions, severe or mild symptoms. But within 48 hours, these patients could easily transition or cross over to acute respiratory distress syndrome. So you need to have a high index of suspicion so that you don't miss these patients, and so that you can start the treatment as soon as possible. On laboratory exam, laboratory findings show increased acute markers of inflammation, that is your erythrocyte sedimentation rate, that is your high C-reactive protein, that is your high white blood cells. Again, non-specific presentation. Yeah, it may as well be COVID. It may as well be cancer. It may as well be, an infection. So you have to have a high index of suspicion. Put all your results together and rule out as soon as possible all the other differential diagnoses, and quickly come to the diagnosis of EVALI, especially when the patient reports to have vaped. On radiology, patients present with inhalational injury localized to the airways, which appears as bilateral symmetric ground glass opacities on your CT scan. You find bilateral symmetric ground glass opacities that spares the subpleura, so they do not touch the subpleura, and with also patchy infiltrates. That's your inflammatory process right there. Ground glass opacities, patchy infiltrates. That is inflammatory processes right there. Inflammation. On histology, lung biopsies have revealed multiple, a constellation of lung abnormalities, including diffuse alveolar hemorrhage. There was a patient who presented with diffuse alveolar hemorrhage together with multiple pulmonary embolism. Yeah. So as you can see again, you may think the patient only has pulmonary embolism, but that is that is associated actually with the EVALI. And this was a very young patient, by the way, that presented with multiple pulmonary embolism, because you may think pulmonary embolism patients would generally be obese and have have cardiovascular risk factors, other cardiovascular risk factors, increased cholesterol and all such things, or sedentary lifestyle. But this patient, EVALI can also trigger multiple pulmonary embolism. Diffuse alveolar damage has also been reported on lung biopsy. Chemical pneumonitis, forming macrophages with the nucleus pushed to the periphery, and you have your foamy cells there, and organizing pneumonia. So a constellation of non-specific presentations. Now, treatment, as we've mentioned, EVALI is basically an inflammatory condition. Like COVID, you will need to give steroids. Again, steroids. But in the US, they've been giving antibiotics together with steroids. But basically, this is an inflammatory condition, so you have to start with your anti-inflammatory treatment, steroids. Now, antibiotics are given for possible pneumonia or any infection. Because you have a high index of suspicion, you do not want to wait too long while you're doing all these tests. Peradventure, the patient has pneumonia and they may progress quickly. They have fever, they have malaise, they have dyspnea. So it is. They have out of prudence, out of abundance of caution, they've been giving steroids with antibiotics together. But it is steroids that resolve the condition. It is steroids that bring about resolution, not antibiotics. Again, I repeat, it is steroids. It is the steroids that resolve the condition. It is steroids that improve the outcome, the clinical outcome of the patients, that increase the prognosis of the patient. It is not antibiotics. The antibiotics, they only deal with any possible infection, but the steroids are the ones that puts off that inflammation, that puts off the fire of inflammation, so that the patient can then recover. Now, and because of that, if a patient continues to smoke, continues to vape, if a patient continues to vape after discharge, unfortunately, they will relapse and they're at risk of rehospitalization. Therefore, you need to advise your patients to stop vaping. Again, advise your patients, please stop vaping. Stop vaping. We do not want you to come back to the hospital again, to go into ICU. And a lot of patients have ended up in ICU. About 60% of patients or more have ended up in ICU with EVALI. 60% of EVALI patients end up in ICU. And so this is a very, very serious condition. As you can see, within 48 hours, patient can develop acute respiratory distress syndrome. So this is not a simple condition. And had it not been for the advanced medical technology and ICU treatment and quick and a high index of suspicion, some of these patients would have died. And so you need to advise your patients to stop vaping, to quit vaping. In fact, the CDC recommends that patients quit vaping, stop vaping. Tell your patients to stop vaping. Tell them to stop vaping. For those that are newbies that want to try out vaping, don't do it. Don't try it. It is not helpful for you. It will not do you any good. You are better off staying away from the vapes. All right, guys, that is it. I hope, and I'm sure this presentation was very useful for you. It has definitely been. It is definitely a very important condition, especially during this time of COVID. And please smash that like button, hit subscribe, and share this presentation with your colleagues. And I'll see you again in the next one. Thank you.